Let me go through this presentation because I know this is an action research kind of data, and I'll sort of give you brief content of my issues and the presentation. I will briefly go through with you the concept of older person in Malaysia and the ages, because we always have policymakers are always confused why age 60 or age 65, because it is an arbitrary age, chronological age for international acceptance, and then for UN we use age 60, and then for WHO they use age 65, because this is in relation to the developed and developed nation, or underdeveloped nations. So for Malaysia, as the government uses age 60 years old as the cutoff age for to define aging, yeah, and of course, in fact, all over the world now they're not using the age cutoff anymore. They're using percentages. So, but our policymakers are still questioning me in terms of which age do we use, you know. So I think that's these things are all arbitrary, yeah. But anyway, we are aging at the lower level of development, and then if you look at our population size, we're more than twofolds over the last 6 decades, and then population health statistics have also improved tremendously, and we are living longer. Life expectancy has risen steadily for males and female, and economic growth and public health development of the country has added years to life. And if you look at these indicators that I put on here in terms of the different age, the different life expectancy, either at birth or at age 65, so we are actually, but we retire at age 60. So we have, for women, it's more than 18 years, no, to live, and for male is less than that. But at the same time, we know that in terms of population, we have two issues actually: the youth birth and the aged birth. This we have not resolved. The issues of the youth and the issues of the aged, yeah, which is coming very fast. Without actually, to me, aging is a silent epidemic, because those people that will be aged in the future are already born. So the programs and policies that we have in place for the young also is affected. It will influence the older person in later life. So this is where you need to look at aging over the life course, because we don't suddenly become old. We go through the life process. So those policies in place at the younger age levels are really critical for how the situation of the person is in the future. Yeah. And then this is my projection, which is not in the paper. This is based on the projection of 2019 UN projection, and I published this in our chapter. And if you look at the speed of aging, we actually have, from aging population, we actually in 2020, we are already an aging society, and we will be an aged society when the population reaches 14%, age 65 and over, because I use the UN categories. And then it will be just within 20, maybe not even 2044, it will be maybe 2042, because it depends on the health status and things like that. Yeah. And there will be a hyper-aged when the population is 21% over. And also, if you look at the duration to double, Malaysia will only take 24 years, where France takes 115 years to double from 7 to 14. So you just imagine the short space that we are. And then if we look at our projection of being aging society in 2030, we only have less than 9 years. We are not really prepared in terms of implementation. We are prepared in terms of paper policy. So this is where we need to look at how we should act actually now, because if we don't act now, the burden will be on us in the future. Because as we look at this one, you all know, but this is how we organize. We organize our paper from the financial literacy part, from the health aspect, the physical and also the social environment, and we have sub aspects in this topic, because I think these are four major categories. Is part of our life, is part of society, is part of how we live daily, yeah, in terms of this. So this is how we organize the paper. And in terms of the financial issues, these are some of the quotations that I got from the data that was shared with us. And then there's also the issue of the different sources of income, and then and also previously Aizan also said the same thing. And there's also the physical limitation, and there's also the issues of age discrimination with the officers when they want to get they want to really look at the accessibility to services. And then if you look at this financial issue in the paper, I go into detail of the measurements of poverty, because we don't really have a measurement for poverty in old age, because we use the standard poverty measure, which is not relevant for older person. Okay, because when you and there are reasons why I say it's not relevant. And if you look at also gender, because of the longevity gap and the health status gap and the experience of male and female across the lifespan will affect how they age, because mostly low education, and then low employment, and therefore not much income, things like that. So these are all the issues that comes across. And another thing also, our perception of the aged doesn't want to work and things like that. It's not true, because they still need to live. They still need to live. Okay? And are we then wanting them to be dependent on the dole? And that's not the way to go. So these are the things that we need to look at in terms of when we look at financial issues or eradicating poverty for all in old age, because you need to have proper measurement. You need also to look at the lifespan perspective, because the aged becomes that because of the experiences or the what you call advantages and disadvantages that they went through the life course, and the need to change our mindset about the age employment in old age, because there is also people say there is a conflict between you have youth unemployment and you still want to get aging employment and things like that. But in reality, when you do the research all over the world, it has a different effect, and it doesn't compete with each other, because the entry points and things like that are different. And even in the super aged nation now, Japan, they are looking at this employment in old age because of the survival of the older person and themselves. Because if you are employed, you're active, you're contributing to the society, and at the same time, you maintain your health. If you don't, you have depression and all those kind of things. Okay. And then we know that this is when you talk about finances, you will also tie in with the multi-pillar social protection system that we have. Okay. And if you look at the different pillars, this and mostly for us, for the low income, we have the welfare assistance, and then we know that when I compare this, but not in my write-up, the changes in the quantum of welfare recipients have moved actually quite fast compared to the other population group, because it started with 80. Goes to 100, goes to 200, goes to 300. Now it is 500. But the quantum of money that they give to the Department of Welfare Services is the same. So they have to reduce the recipients, and they have to reduce, because the way we finance things, yeah, we don't have line budget. We have one lump sum, and it's up to the ministry to do the line budgeting. And then if the quantum is the same, then you have to play around with the figures. So that's the issue, because I've been with them for a long time, that I understand all these things. And it is an issue that we need to look at. How do we sustain this kind of, and besides giving for BOT, we also give populist financing for other groups of people. So this is another thing that we need to look at, yeah. And we also need to look at how we can sustain the social protection or the saving for the people in Malaysia, because we know that we have very poor saving rate. The data that we showed, the BNN showed about saving is institutional saving, not household saving. Household saving, we have very low household saving rates. And so this is an issue, because when you have risk in the society in terms of climate risk, per risk, that's what happened when the government has to do a withdrawal for EPF and things like that. But it doesn't solve the problem. Okay, so these are the things that we need to look at, the social protection system that we need to institute a stronger and a more integrated social protection system. Because right now we have very fragmented social system program, and majority of the money that we borrow from international funding is for non-sustainable funding for social assistance. To me, it is not the right approach to do. Okay. In terms of health issues, we have the multi-morbidity in old age, because of course these are the issues related to behaviors, because we don't really take care of ourselves, of our health and our food and things like that. And then we'll have multi-morbidity. And in multi-morbidity, the way we deliver services is different, because in multi-mobility, it is a progressive disease. The services that is needed is long-term. Okay, and we don't have that system. What the Ministry of Health has is curative hospitals and things like that, but the step down services is non-existent, except maybe in the community, but very limited. And the issue for aging in terms of health is the mental health status, where we really need mental health services. Because it is also about stigmatization, because our mental health, because culturally, when you say mental health, it is apa tu? Orang yang apa? Orang gila, psychiatric case, which is not. Because if you look at now, mental health is all this dementia and all these kind of things, which they can still function. They're not orang gila, but we don't have these services. And we have very, very limited services for this, only found in KL, Ipoh, or the big towns, where the NGO provides this thing. But we don't have others. And we also need to look at how do we manage, because we don't have social protection, one thing, and we have Mental Health Act, but Mental Health Act is so high up there. Our delivery system is down here, so it there's a huge gap in terms of that, because the act is very ideal compared to what we have. So it's not implementable. Okay, and we for Ministry of Health is only now they changed the name of Tanjung Rambutan already, and the other we have only two, and that's not suitable for the normal aging person. Okay, so this is a huge gap, and we will be facing this in just another 2-3 years about the burden of people, because people don't have skill to okay, and also because of the requirement and understanding of MOF is that if you have dementia people in the community, you must have psychiatric nurse and things like that. And we don't have psychiatric nurse in Malaysia, and we cannot import psychiatric nurse into Malaysia. Things like that. So there are huge issues in terms of the health issues, the achieving SDG in terms of good health and well-being, and the gender, of course, gender, and also in for us to really develop on health, we need to have partnership. in health delivery, because we need to have a continuum of care kind of system in the government structure. It's not there in the community, haphazard, and it's not connected. And also, if you want to create health as a care economy related to health, then there are several issues that we need to address. For example, in terms of licensing, in terms of the requirements, and in fact, the issue of implementing the new Private Healthcare Act is still not implemented yet. It's already been 3 years since it's been approved. Okay, so and we have the health interventions here and in the paper that I mentioned, and most of the health interventions are for the B40s people. And also we have some my salam, but it's also related to BRIM and all these people that is eligible for support. But majority of us Malaysians do not have health coverage in terms of that. Yeah, and in terms of physical environment, the maintenance of public housing issues, and there's also poor sanitary and drainage system in terms of that, and poor street lighting. To me, these are basic infrastructure that should have been there for the people, okay? Because these are basic. So, and this relates to the issue of sustainable cities and communities, and just clean water and sanitation and things like that, where the issues arises, and I did present this, and also the issue of public transportation and accessibility, road accessibility to health services and things like that. For example, I quoted, I think, Tanum, they only depended on the train to go to hospital and things like that. So what more, you know, and things like, which is, to me, is a really, really very basic infrastructure. And there's also issue of house and land ownership, because if you don't have land ownership, you cannot get benefit from the services that is available for the people and things like that. So these are issues, and probably same with Orasli Ibunya too, in terms of home, the land ownership and things like that. Okay, and of course, in terms of the physical plan, we have the RMF, National Physical Plan, where we have the different functions that hopefully would design for us to live in peace. But if you look at this, we don't really have the interaction between the federal government, federal policies, the state government, and the local environment, local authorities. Because in my study on age-friendly typing, they don't talk to each other. So, and that's difficult, because we need to talk with each other so that we can have proper physical plan for us to live. Yeah, and we have social issues in terms of programming. They reported lack of training services and things like that. Because when you talk about older people, there's also this ageism where this training maybe is not suitable for one poor, but they need it. They need it. So that's why, to me, they will need to have this lifelong learning, this training programs that the authorities have, but to include older people as part of the audience in that. So this, because what's important is that you need to include them. You cannot dismiss them in whatever delivery of services that you have. So this ties in with the quality education and the lifelong learning education that we have. And we also have the new PSH policy for Malaysia, that we need to look at how education plays a role in terms of putting people to serve the economy and things like that. So that is a link together that we need to look through how we can do this, because lifelong learning is not for education, it's not for employment per se, but it is also to educate yourself for self-management, for self-care and things like that. Because if you don't do self-care, then you become worse in terms of health status and all that. Yeah. So this is the different programs that I shared with you all in terms of the need for them to get assistance because they don't know what's available. They don't know how to fill up the application forms. Yeah. So and my recommendation on this is in terms of finances, creation of job opportunities and job placement for displaced person, marketing outlet for produce because they complain that farmer is not doing the job. Yeah, community watch group, community gardening, enhanced training, beneficiary indicator or target mixed top down and bottom up approach to planning, legislation of social assistance program, and hopefully we can develop household registry to be used where we can find the target for implementation of all the different programs. We need to remove barriers to accessing health, prevention and management of non-communicable diseases, health financing, integration of health and social care services, promotion of healthy lifestyle, and we need long-term care services in terms of physical environment, age-friendly towns and cities, and we need to improve public transport system in the rural areas. Yeah, and the last one is the social intervention, more publicity on the programs, and also to look at how we can revise the program so that the older person are included in the society. And we need to remove the attitude about the myth of older person and things like that. Because if we have a negative attitude of older person, then we don't include them in all programs that we have. Okay, and in conclusion, aging population has implication on finance, health, social and physical environment, the different pace of aging and the uneven spatial distribution over the person in the state will imply localized needs and localized solutions, though the population is not a homogeneous group as their background and experiences differ widely. Having better evidence will not generate one-size-fits-all recommendation. More local evidence and research is needed to develop sound planning and action at the local level, and because these are the local level analysis reflect national analysis, issues and challenges on the aging in Malaysia. So thank you.
Okay, thank you very much. I think let's give some points that we have raised on partnership, especially understanding the disease.
Yes.
You know, in terms of the multi-morbidity. Very common. Even young people are getting it now.
Yes.
So it's not only the disease pertaining to older persons, right. That issue is now merging with young people. And also lifelong learning is important. I remember once Dato Sue, our former Prime Minister said this: if you stop learning or active, you become rot.
Yes. You
start rotting already. So it is something that's important for older persons, learning important active. So thank you so much. And let's welcome our external reviewer, Dr. Murali. I hope you are ready.
Yes.
Thank you so much. Over to you, Doctor. And you've got about 10 minutes.
Okay. So thank you very much, Dato. I think very interesting paper. And you put quite thoroughly at the problem. Ironically, I think it's been just comment that I think we've been trying to work at aged care for years without any much success at it. What is this? In 2011, the ASEAN and WHO, we actually tried to put in a long-term care insurance program for ASEAN countries. So that time I was based out of Tokyo for about a year and a half, trying to build a comprehensive long-term care insurance. But I think there's no take-up, basically. Yeah. There's no kind of financial buy-in. So just to maybe sum up some of the things that Dato was saying, and I think one of the first big challenges I think Dato put forward is this idea of aging, and how it as a concept as well, it's something that's not been well understood and taken up. In fact, as a society, we still struggle to decide who's old, who's not. And within our minds, there's this idea that it's 60 to often die. And that's moved a little further along. I think my boss in Tokyo was 103 years old. And yeah, so it's very contextual. We're doing much better at making people live longer. But I think Dato's brought up this very important point that making them live longer doesn't equate to them living better. And I think that's one of the kind of big challenges that was brought across the different areas. You were also speaking about the issues pertaining to such issues which are cross-cutting across the SDGs, but particularly within the aging society pockets such as poverty. I think you also spoke about the challenges in financing welfare. There's quite a bit about that you also spoke about, and you raised these questions within the paper as well, in the misperceptions of the ability of society to understand that within the aging kind of population, there's the ability to contribute, and also there's quite a bit of productivity within them. And I think you also talk about the kind of needs gap. We're unable to understand what they're able to contribute, and we're unable to remunerate, to understand how and where to remunerate them. In terms of we're judging them, and maybe Dato may have some moments to add into this later. We seem to be judging them as we judge a 20-year-old or 25-year-old in terms of what you're able to contribute in terms of man hours, rather than looking at how much they're able to contribute in terms of like technical expertise, that kind of idea, mentorship, rather than going into this 5 hours, $10 an hour in McDonald's kind of idea, which is unfortunately what we seem to be pushing them to do back again. There's also, I think, a very important points that you raised in terms of challenges in providing aged care, the inability of us to actually have any kind of ecosystem to manage people who are elderly, and then within that, a subset of elderly people who are chronically ill, both whether in terms of physical health as well as those having mental health issues. And so within that entire ecosystem, I think, and Dato points it out very significantly, that there's outside of the metropolitan areas, maybe I think Penang, KL, Ipoh, perhaps JB, there's nothing in terms of an ecosystem in across these other areas. So what Dato also did talk about, and quite thoroughly, I think you did go through and bring up for the reader and for the rest of us as well, is all these kind of assistance schemes that are already in place. You talked about the saving schemes for housewives, the welfare kind of assistance schemes, and how they've also been woefully inadequate. Good ideas, but unable to be implemented in the large scale due to all these kind of financial restrictions. And as well as the kind of physical environment challenges in terms of the government, I think is a bit more observant to ensure or prioritize that housing and all that is being provided for aged people. But these seem to be in built environments that are not suitable for aged people. So for example, PPR, high-rise PPR flats in which they've got almost no access to, greenery, or even things like throwing rubbish. I saw a quote from you that people found it very challenging to actually come down to throw their rubbish or even to get their groceries and all that. So these are like measures in which they've put in place a little bit, but in terms of the effectiveness of it over the long run, I think there's quite a bit of challenge. That also raises, I think, things about ownership, land ownership, and some challenges pertaining to that. And also, I think we talked quite a bit about this idea about lifelong learning, about reskilling, retraining, and job creation. So some of the recommendations that Dato has called for example, I think is about putting them back into productive roles within society. job creation, training, retraining, and how this is actually not being well looked at, I think, for the age community. And that should be, I think, and you mentioned that as well, Dato, that you give it quite a bit of prominence. And I think I agree with you on that, because that may go a long way towards also relieving the financial burdens associated with providing care as well. You know, so and I think that's an important kind of role to this one to kind of push forward. Also, again, to share maybe of interest, and I'm sure you are aware of this, in Tokyo, for example, or other metropolitan parts of Japan, they actually zone all your nurseries together with your old folks' homes.
Yes.
You know, so that your old folks are able to take care of the school children once they come back from school until their parents come to get them at about 6 o'clock. It gives a lot of functionality to the old folks as well. And then, of course, they get paid a stipend. So these are, I think, solutions. I think one of the, as Dato points out very rightly, I think one of the good countries to look at is Japan, simply because everyone there is old enough and they've kind of grown the ecosystem for aged care very significantly. In Japan, again, an example to take perhaps is the idea of long-term insurance in Japan. From the age of 35, now you start paying about 6 or 8% of your insurance into a separate long-term care insurance, which is then used for you when you finally retire at the age of 80 or 90 or whatever it is that you do in Japan. So that also speaks to the idea of long-term care services. And you've given some examples of what this two-side activity, Warga Emas, the PAWE. I think you also talk about the club Warga Emas. These are kind of some solutions which the government has tried to put into place, but even PAWE, as Dato would have seen, is it's sky and earth. So there's some PAWE which is KLCC level, and then there's some which is quarter area in actually not even Pantai, in Jinjang punya level. So it's between the PAWEs, so there's a lot of discrepancy and not uniformity. So coming perhaps to just package this together, I think that was kind of, I really like the idea of this interconnected kind of matrix that you put forward of this financial, healthcare, the physical environment, the social environment, kind of tie these big issues pertaining to aging within the Malaysian landscape. And I noticed that you've paid quite a lot of attention to go and see how it is outside the urban settings, and you give us a very kind of comprehensive picture of how things are in the other non-urban constituencies. So thank you very much for that. I think it's a really very learning, a lot of insights for me from reading your paper, and I think it sums up very eloquently this entire kind of problem as it is. So yeah. So that's about it from me.
Okay, thank you, Dr. Murali. You touched on challenges for the age, reskilling, production, becoming very productive role, which is actually very important. Not aging. Because I see when I speak to my mother, 85 years old, and of course she has dementia and all that, there's always something that I can get from her at the age of 85. Of course, yeah, I think Dr. also touched on employment issues, and then in Japan, that's something that we have highlighted. Probably later you could also touch something on the Tengku system that you have actually quoted and model, but actually it was also introduced in Japan. Also, because I do remember when I was in Japan, the welfare department. So they know exactly where all these older people are located, and we help them to distribute food packets. They know exactly. It's very targeted because I think of the welfare system. Okay, so that is from Dr. Murali.